number of deaths due to heart attacks and other diseases is much more than the COVID deaths. Is it correct?
Absolutely. I mean, that has been there all the time. I can tell you the figures that nationally, 7,000 patients die from a heart attack, but at the moment, as you know, nationally, 1,000 patients die from COVID. So,
Sometimes more.
That's right.
Yeah.
And that is known.
We don't spend that, and we don't pay that kind of attention to heart attack.
No, I've said this openly in various forums of interviews, that every COVID death hurts. But let us not forget the fact that more people die from other illnesses, far more people die from other illnesses, and therefore our concentration cannot be devoid of what we need to do for non-COVID patients, their cancer patients, their heart patients, their lung patients, their patients in every disorder, lives which can be saved every day with the same rigor as we save COVID lives can be saved every day. I'm sure heart attack patients, death due to heart attacks must have increased at home. Unfortunately, we don't have those Western systems where you dial for an ambulance and an ambulance picks you up. But Chawla, in the West, it's clearly documented where they dial a 911 and the only way they get to the hospital is by ringing an ambulance, which comes in 5 minutes' time. The time period showed, both in Italy and in the United States, that deaths from heart disease, heart ailments actually doubled during that time frame, in which heart attack patients decreased coming to the hospital. People suffered. That's what it was. And therefore, the emphasis clearly is, come to the hospital if you need to be saved. If you have a disease process which is getting worse, if you have an illness which requires urgent attention, you must get to see a doctor. If it needs admission, you must be admitted. If it needs treatment, you must be treated. Please do not ignore your symptoms. What we only say is, if you've got a routine checkup due, that can easily now be done on teleconsultations. It can be done on phone. It can be easily done. And a routine trip to the hospital can certainly be avoided at this stage.